with the healthcare industry in general for consumers or patients.
So what could we do differently?
Yeah, I mean, I think there is a hyper focus right now in healthcare where all the stuff that we've learned and excel in the hospitality industry. I think a lot of that is starting to transition, into big healthcare systems, but also small clinics. I think consumerism is rampant in our society, and people want a good experience. They want to get care when they need it, when it's convenient and accessible, and they want it like the way we get our Amazon packages, delivered in 2 days or less. And I think what's challenging is the historic paradigm of medicine was like, you have a physician or other clinician who's seeing patients, and they have a schedule, and you have to fit into that schedule. And if that schedule's full, you have to book out. Like, I mean, can you imagine if restaurants were like that? Like, you couldn't eat at a restaurant for 2-3 months because the restaurant was so popular. I mean, people would freak out.
Yeah. Or they'll say the doctor doesn't do their schedule 6 months out. That's
correct.
Another one that's
we don't have the template.
Yeah. So I think also call back tomorrow at 8. And if you're lucky at 8:15 that you get in that first day, same day. I saw someone post something that they were pediatric care at 8:02. They couldn't get to see in. So where do they go? Urgent care. So anyway.
Correct. Yeah. And I think that's the nature of the system is like, I think fundamentally all patients want, I mean, I'm a patient too, obviously I'm a physician, but I have to get care at times as well. And I think all people really want is they have a concern, and they want like that concern addressed, not necessarily resolved or, completely rectified, but, if it's a minor kind of acute thing, they just want the advice of what they should be doing. And I think that part of medicine is really challenging right now because you have to fit into one of those like scheduled buckets, of care. And there's asynchronous ways too, like different practices will have like either, questionnaires or e-visits or, even emails that you could like send. But those too, I mean, those are okay, especially when they're nice and structured, so that person gets the right info. But I think we need to kind of push the envelope to think differently in a lot of these ways.
So I guess with AI that I'm hearing,